What's up, guys? Welcome back to the channel. Today I want to talk about a very common symptom of anxiety, and that's shooting chest pains. But you know what time it is. Smash the like button down below if you're ready to kick anxiety in the butt. Leave me a comment. Let me know if you've dealt with this symptom. You are not alone. I dealt with it for years. I had cardiophobia, okay? So I definitely had my fair share of chest pain. If you're new here, please join this community, this family, okay? You're not alone. You are not alone. I have many other anxiety help videos and videos about anxiety symptoms to try my best to give you a peace of mind and let you know that anxiety can cause these things. So before we get into this video, guys, it's very, very important for me to let you know if you haven't seen a doctor concerning your chest pain, you need to get that initial reassurance before it's even possible to work on acceptance and work on your overall anxiety problem. I'm not a doctor. I'm not here to diagnose you with anxiety. I'm not here to diagnose you with a heart problem. That's your responsibility, all right? So please see a professional. Same thing, if you haven't been diagnosed with anxiety disorder and you're suspicious of that, go see a professional and seek some extra help. All right, that's on you. You need to be sure to do that. But if you've gotten your initial reassurance, the doctor's told you that this is anxiety, then this video is going to try to explain to you how anxiety can actually cause this, because that was very, very important to me. You can tell me all day that anxiety causes a symptom, but how does it cause that symptom? That would make me feel a lot better, because in the beginning, it's hard for us to wrap our mind around the fact that anxiety can do all of this. All right. So at the beginning of my health anxiety, the first 2.5 years, it's actually like the first half of my health anxiety that lasted 5 overall years, I had cardiophobia. So I was afraid of all things heart. I'm talking about heart attacks, arrhythmias, heart failure, AFib, tachycardia, anything in and around my heart worried the crap out of me. I thought my life was going to be over like that multiple times every single day. So I had a lot of symptoms that was in this area: fast heart rate, high blood pressure, any type of chest pain, numbness, tingling. And whenever it came to chest pain, guys, we're talking about above, below, left, right, center, radiating, crushing, sharp, the shooting pains that we're going to talk about today, dull ache. I had every type of pain. Sometimes it would come on suddenly, and then sometimes it would be constant for weeks, depending on my state of anxiety, which could be through the roof with my fight or flight, or it could just be on autopilot. I had chronic symptoms and acute symptoms. When you've had anxiety for a very long time, tension builds up, and that's the first thing that I'm going to talk about regarding your shooting pains. Me, and like many of you, if you're searching this video, your chest area is very sensitive to muscle tension and stress. So there's a lot happening up here. We have our overall chest cavity, breathing cavity. Our rib cage is very, very close. The top part of it's right there towards the center of our chest, connects to our sternum. We have cartilage everywhere in this area. Then we have our pecs. We have a lot of muscles surrounding all of that. A lot is going on in this area that isn't necessarily your heart, okay? And I think a lot of us that have anxiety, it's hard for us to accept. It's hard to tell what's muscle pain, what's heart pain, right? And after all, you know, the heart is a muscle. So we can get a lot of things confused, especially if you have health anxiety and cardiophobia like I did. But this area got tight really, really fast when I would get anxious. Whenever I would have panic attacks, the first thing that would start hurting is my chest. So a lot of different pains can happen here, but we're going to kind of talk about the shooting pain. All right, whenever you think of shooting, you think of something moving very fast and starting in one area, moving to another. Now, I know not everybody is going to describe it the same way, and you can look up different definitions online, but I'm just trying to do my best to explain it from my point of view and through research and stuff that I've experienced, okay? So it can start somewhere. It usually moves very, very quickly, which is kind of good news because it doesn't stick around typically. It lasts a second or two, and then it goes away before you have another episode of it. So start somewhere, run somewhere else. Now, where can this happen? Anywhere. And it's not just isolated to your chest. You can have shooting pains all over your body. So the first culprit is extreme muscle tension. And then all it takes is you moving just a certain way, up, down, side to side, angled, for you to have this disruption in the muscle that's tight, and it can cause these shooting pains. So that's something that would happen to me a lot. I would usually do a lot of stretching and everything like that, and usually that would kind of solve the problem up before, you know, an hour or two later I would have another one, okay? So I would have these all throughout the day. And of course, me having health anxiety, I'm thinking like, oh my God, is this the one? Is this the heart attack? So, and I would have a lot of symptoms that would follow it. And all it took was a symptom like a shooting chest pain for me to go out into a full-on panic. So that's something I would deal with. Something else that could be happening, guys, is your nervous system is extra sensitive and overstimulated. So nerve impulses, nerve signals, whichever way you want to refer to them, they're usually on autopilot and they're functioning normally. Whenever you have anxiety, they can be very, very erratic. So you can have this tension that's already in place, and then you have these erratic nerve impulses that can give you these shooting pains as well. So that's another culprit. As far as getting past this, guys, I can sit here and talk about progressive muscle relaxation, doing some deep tissue massages, stretching, staying hydrated, make sure that you're active, healthy diet, things like that. But you have to get your anxiety together as a whole. You have to shut off the motor that's causing, the tension and the symptoms. So that's a ton of things. It's not just the diet, the exercise. We're talking about gratitude, self-love, your root causes of anxiety, acceptance, and I can go on and on and on. Grounding, everything. There's so many different things that come into play that you need to be doing at the same time to recover. So if this is something that you're interested in, I have a step-by-step blueprint on how I overcame anxiety disorders. Yes, GAD, generalized anxiety disorder, health anxiety, and panic disorder. I had multiple panic attacks a day as well, and I have been free of that for well over 6 years now. So take a part of that course. If you have not done that yet, I'll put that down below in the description. If you want these symptoms to go away, if you want to start your path towards recovery, that is for you guys. Also, the description, tons of things down below. If you've never tried therapy, this is your opportunity. Online therapy is down below as well. I have all my other social media, social networks, TikTok, Instagram, Twitter, Snapchat, all those things are down there. I do a lot of content on various platforms, so be a part of that. Remember, please leave this video a like if you got some value. Leave me a comment if you want to just say, hey, what's up, or if you want to talk about some symptoms. That option's available. Subscribe. Again, if you're new here, be a part of this family. And until next time, keep fighting.